Hello, everyone, and welcome to The Wrap, brought to you by Michigan Medicine Headlines. I'm Dan Ellman with the Department of Communication. Today, we're going to close out Breastfeeding Awareness Month by talking with members of the Breastfeeding and Lactation program at U of M Health. Now, before we get into that important conversation, be sure you take a few minutes to get caught up on any episode of The Wrap you may have missed. You can find the shows on iTunes, Stitcher, or any other podcast hosting platform. They're also available on the Michigan Medicine YouTube channel and as part of the Headlines Week in Review. On that note, let's bring in two of our colleagues. First, can the two of you introduce yourselves and explain your roles in the organization?
So I'm Maria Scotchelis. I'm a pediatric hospitalist at Mott, working in children's and women's as a medical director for the newborn nursery and also the medical director now for the breastfeeding and lactation program.
Hi, Dan. I'm Kelly McCarley. I am the clinical nursing director for Von Voigtlander's postpartum unit and also the new clinical nursing director for the breastfeeding and lactation program. My background is working as a lactation consultant for about the past 17 years.
Outstanding. Well, thank you, Kelly and Maria, for being here. Now, we've mentioned the breastfeeding and lactation program. What exactly is this program?
So the breastfeeding and lactation program is building off really of the work that had been started probably ages and ages ago by so many members of our community. The goal is to create a more comprehensive program that crosses the continuum of care. As people recognize, breastfeeding isn't just a hospital thing. It's not just a baby thing. It's not just a pregnancy thing. It's something that crosses a good chunk of the all of pregnancy, as well as over the first 2+ years of life of the baby's life. And in my role as medical director of the newborn service, we saw a really high intention to breastfeed. But what we were noticing is that our patients were a little bit surprised by what breastfeeding was, and the rates of breastfeeding quickly fell off. So out of that, the breastfeeding and lactation program was born to try to pull together all those amazing people who've been working on this throughout the years and provide a more comprehensive support structure for our patients.
And Maria, just to build on that, I think, cross continuum is our goal, but that also creates this opportunity for cross-disciplinary work as well. It's been a lot of work's been done by the lactation consultants who are certified as lactation consultants working as nurses in the hospital, but this has given us an opportunity to partner more on the medical side with providers, more with our outpatient colleagues. Some of our strategic advisors are involved in building the work, so it's been a really nice, exciting opportunity to do some multidisciplinary work as well.
Yeah, so let's dive just a little bit deeper into that multidisciplinary work. How is this team being formed? What's the work look like that's creating the team?
So I'll start, Dan, just to give you a little history. For probably the past 10 years, maybe a little more than 10 years, the support of breastfeeding families in the hospital for the inpatient setting has primarily been a team of two separate lactation consultants. So we had one team who handled kind of our well newborns, the birth center population. So that team was dedicated to those families. And then a separate team of lactation consultants who cared for our neonate, the babies in the NICU, help me out, Maria. That's not my environment. I'm in the
premature infants primarily.
Yes, premature infants. Our Mott hospital, any readmitted pediatric patients, any readmitted maternal patients over in the main hospital, and then they also supported our outpatient clinics. So again, functioning as two separate teams, we have recently brought those together to align them as one unified team, which will give us the ability to couple things. It will give us the ability to allow them to practice within the full scope of their practice. They've been really hyper-focused on specific areas. For example, the birth center lactation team has been focused on the first 24 to 48 hours of life, supporting those families. They are credentialed and skilled to provide care for breastfeeding families from the point of pregnancy through weaning, actually. So they aren't performing right now in the full scope of their practice. They will now have that opportunity. It also allows us the opportunity to look at possibly reallocating some of those resources and expanding our services to more of the outpatient setting where we have had a gap. We've been really heavily focused on the inpatient setting, and we have an opportunity to improve services in the outpatient setting.
And I'll just add, I think we're talking about the multidisciplinary nature of this work. What's really cool to me about breastfeeding medicine is it's not owned by one specialty in medicine. It crosses a number of different specialties. So it's been a fun opportunity for me to work with my nursing colleagues, lactation colleagues, but also obstetrics, family medicine, pediatricians in the inpatient and outpatient setting, adult medicine colleagues. We were just chatting a couple weeks ago with folks in the SICU, and no one thinks about breastfeeding in the SICU, but it happens. We have patients who recently delivered and want to breastfeed, and being able to partner with critical care folks on the adult side will allow our patients the support they need to achieve their goals.
Yeah, so that's one of.
That
Oh,
reminded
sorry.
me,
Go ahead,
sorry,
Kelly.
Dan, just
No.
reminded me, Maria, one more opportunity we found here is just re-engaging with some of our community partners as well. Historically, and I think COVID set us back a little bit with some of that work, but historically, we've had partnerships with some of the lactation or breastfeeding peer counselors through the WIC organization. There are lots of great community organizations around doing really wonderful work, and those relationships have kind of lapsed recently. So we're trying to re-engage with those, get input, because we recognize that for most families, they turn to their healthcare provider for the initial support in getting started with breastfeeding and lactation, but the community and the society that they live in is a big source of that support going forward after discharge. So, re-engaging with those community members and doing what we can to support families after they leave the hospital environment as well.
Yeah, and you may have already touched on this, especially with mentioning the SICU patients and things like that. What would you say are the key benefits for patients and families to this new program and new functionality that you have with these cross-disciplinary teams?
I think we'll be able to fill our gaps better. We'll be able to give patients the resources they need. Kelly is doing such great work working with the lactation consultants who've been in the NICU, working with our lactation consultants who've been in the birth center. And then now we're also talking to all the clinics to find out what gaps they're seeing that we've just missed. And I really want to emphasize that we've gotten so much great support from the hospital, and we're also getting good, building good connections with our outpatient colleagues so that we can put the right supports into place for the families. And I think that's a thing, filling the gaps for the patients so that they can get the care they need when they need it and that they don't have to search. I think my youngest is now 6, and it became very clear to me when he didn't regain birth weight at 2 weeks that we had problems in this system. I'm a pediatrician. I know how things work, and I was having trouble getting him the support he needed. When we saw his pediatrician in clinic, she was phenomenal. Dr. Oringer out of Briarwood was lovely and knew exactly what to do with getting me connected with Carrie Pulowski, one of our NICU lactation consultants who saw me in clinic and got me in very quickly. But then getting that follow-up care that I needed, that Carrie recommended, that's where the problems came, because we didn't have an overarching program that was able to work with physicians in different settings to explain why things were needed. So I had to make a lot of phone calls to get myself into clinic on time, to get myself into other clinics on time. And I know how the system works. That's not what our patients should experience at all. And don't worry, he's 6. He drives me crazy. He's really healthy. And I'm really thankful for the support I got from those folks, but it did take a lot of phone calls.
Maria, I think you highlight a really key point to our program too. It's really about meeting patients where they are and helping them reach their own individualized feeding goals. Breastfeeding is very much an art. There is science to breastfeeding, but it's very much an art, and it is not a one-size-fits-all model. So you as a pediatrician, I know you personally, you have 4 children. All 4 of those children did not have identical breastfeeding experiences. So you couldn't have success with the first 2 and then hit a roadblock with the 3rd. And so it's really about meeting families where they are, providing them with the service that they need, and individualizing that based on their experience and their individual goals with each time as well.
Well, I think it's also interesting in that, when you're breastfeeding, it's a very stressful time in your life, right? You just gave birth, your whole life has been changed. Obviously, hopefully for the better, but it's been changed. Like nothing is the same. So you're already feeling the stress of that. The last thing you want to do is make 15 phone calls just to connect with somebody, right? So if that work can be done for you a little bit, I think that's a huge load off of a mother's shoulder. So let's look ahead, to the months and the years ahead. What are you most looking forward to when it comes to the future of this program?
We just had a retreat yesterday, Dan, with all of our lactation consultants. Maria was there, I was there, some of our other strategic partners. And it was really exciting to bring everyone together. We have so many opportunities. It's kind of a matter of just prioritizing where do we begin. And I think one of the glaring gaps that we're all noticing is we have a lot of improvement to do in the area of prenatal education for our families. Right now, a lot of this education is being done on admission in the birth center during a very short stay. They're here 24 to 48 hours after immediately giving birth. It's not a good time to give or receive education, yet that's our current model. So we know we have a big gap there that can be improved. Looking at opportunities for virtual visits potentially for the most far-reaching effect probably for these families. We've discussed with some of the outpatient clinics that, most families are really comfortable. They have a good relationship with their pediatrician, with their OB provider, with their midwife provider. They're comfortable in that environment, in that clinic environment. How can we get to them where they're comfortable and provide them with the education they need prenatally to prepare them for the hospital stay, and then also continue to support them where they need after their discharge.
I'm also really excited about utilizing this to support our learners and our trainees. I've had so many trainees come to me interested in breastfeeding medicine, and to that end, we've been able to establish an elective in the pediatrics residency and in our pediatric hospital medicine fellowship. And we're also looking forward to starting a journal club. So really looking at the evidence behind what we do. Kelly mentioned that breastfeeding is such an art, and there is so much of medicine in general that's an art, but there's also science to it. And as a pediatrician, I get really excited about the physiology and the pathophysiology and utilizing that knowledge to meet that family where they are and help support them in their goals.
And I think some of the other exciting work just in the connections we've been making, Maria, we're meeting people throughout the institution who are doing little pockets of this work already. Our 12 East colleagues here in Mott, I think there was a group of 16 nurses that have volunteered to become breastfeeding champions, and their nurse educator has put together a whole program. They've been partnering with our lactation consultants to shadow both inpatient in the birth center, the pediatric units, and our outpatient clinics. Over in the adult SICU unit, there's some work being done there to really advocate for those patients who are transferred from the birth center to an ICU environment and how to initiate lactation for them. So it's exciting to see that there is interest in this work, and we can start organizing better to keep us all consistent with our messaging, providing good, solid support for these families, and just start partnering together.
That's great. This work is so important, and I love how you're bringing it all together. Is there anything else that either of you would like to add before we put an end to this conversation that we haven't touched on yet?
I think one thing that I'm hoping and dreaming of is a donor milk bank right at the University of Michigan. Currently, there are 2 other milk banks in the state of Michigan, and when we get donor milk for our most vulnerable infants, those in our ICU, our premature infants, we're actually buying it from Bronson. So that is one of my dreams. If anyone is interested in that, by all means, please reach out.
Outstanding. Kelly, anything?
Recognizing, oh, sorry, Dan, recognizing some of the work that's been done before we've come to this work. I think it's the Briarwood Clinic was one of our original outpatient clinics. That's been there for at least 10 years or more. They've done so much work historically toward this project. And now to have the support of executive leadership to continue the work and really bring this together as a collaborative, full, comprehensive support program, educationally for faculty, staff, supportive wise for families, community members. It's really exciting work. It's really important work, and it's nice to have it validated and supported.
I love it. Thank you so much, Kelly and Maria, for sharing this information about the breastfeeding and lactation program. Now, if our listeners want to learn even more about the program, check out this week's feature story at mmheadlines.org. That's mmheadlines.org. All right, it's time for the lightning round when we ask one of our guests 4 quick fire questions. Maria, we're going to put you in the spotlight today. Are you ready to go?
I hope so.
It'll be easy, I promise. All right, we're about to reach Labor Day, which means summer is just about over. What would you say is your highlight from the past few months?
I've been loving the sunshine, being outside and getting out on my paddleboard with my kiddos.
Love it. Love it. All right, so now let's look forward to fall. You more of a pumpkin spice person or, an apple cider apple spice person?
Ooh, can I choose both?
There's no rules here. You can pick
All
whatever
right,
you
it's
want.
too hard. It's too hard. I think I actually do have to go with both. It depends on my mood. Maybe apple cider in the evenings, but a pumpkin spice latte is always fun.
Perfect. Perfect. Who would you say has been the biggest mentor in your career?
Oh my gosh. I think my nursing colleagues that I've worked with, and I can't pick just one. Being medical training, sometimes you get stuck in the silo of doctors, and learning from my nursing colleagues has been really fundamental to changing the way I care for my patients.
Love it. All right, and this is sort of in the same vein. What would you say is the best piece of advice you've ever been given?
Find your joy. Find your joy in medicine. Find your joy in what you do, because that's where you're going to do your best work. And that's how you're going to, a lot of folks are talking about burnout. That's how you're going to fight burnout, just by finding your joy.
Great. Thank you so much, Maria, for playing along and for helping us celebrate Breastfeeding Awareness Month. Once again, if you want to learn more about the breastfeeding and lactation program at U of M Health, be sure you visit mmheadlines.org. All right, it's time for the weekly trivia contest. This week's question is, 4 U of M medical students are participating in a triathlon to raise money for mock clinicians to travel to which country? Once again, 4 U of M medical students are participating in a triathlon to raise money to help send mock clinicians to which country? You can find the answer in headlines, and once you know it, send it to headlines@med.umich.edu for the chance to win a prize. That's all we have for today. Maria and Kelly, thank you so much for joining us, and thanks, as always, to our listeners and viewers for everything you do for patients, families, and each other. We'll see you next time.